Hi, my name is Lori Pellatt, and I am the Transition of Care Clinical Coordinator for Wentworth Health Partners. I have put together a few slides to review some information about TCM Billing, so as we head to our new EHR, you will have a better understanding of the core requirements of this bill. As a review, for those of you that we have not met in person, our team is comprised of 3 nurses and a clerical support person. Nurses include myself, Sarah Rodriguez, and Rosanna Gonzalez. Our clerical and billing support person is Violet Baker, who brings a wealth of practice management knowledge to our team. I want to take this opportunity to let you know that we are always here to answer any questions you may have. With the implementation of eCare, we are expecting a few key changes to the TCM billing process that you need to be aware of. Let's first review the current process. Patient is discharged from a qualifying hospital stay. Calls to the patient are made by the TCM team. The patient is seen in the office. The provider inputs the TCM codes to the finalized portion of the visit. The code at this point, it's important to note, is not dropped. 30 days after discharge, the TCM team reviews the chart to ensure all necessary ingredients are in place to bill the TCM. TCM team then signals the billing staff to go ahead and drop the code. Bills may not be submitted to insurance company for weeks after the visit, as we are waiting until the 30th day after discharge to do so. Let's review the new process that we will expect in Epic. The patient is discharged from a qualifying hospital stay. Calls to the patient are made by the TCM team. Patient is seen in the office. The provider will now select either the 7-day or the 14-day TCM charge from their level of service pick list in Epic. The bill will be submitted directly to the insurer at that time. Because the bill is being submitted directly by the provider and at the time of the face-to-face service, we want to take a few minutes to review the TCM process and core requirements that you'll need to remember before submitting the code. Let's start by conceptualizing transition of care. First, we are looking at all of our discharged patients within WIP. We know that these patients are at a higher risk for complications, including readmission. The TCM team's goal is to reach out to these patients within the first 2 business days after discharge and to guide them safely back to their patient-centered medical home. The intervention is a brief but focused care coordination attempt. Our main goal is to review discharge education and to reinforce the current plan of care. We do find that by the first and second day after discharge, patients are generally more engaged in the discharge education process than they may have been while hospitalized. We use critical thinking to prevent potential complications, as well as facilitate resources that may be helpful to the patient. That could include referrals to VNA or other services. We may also be helping them to identify barriers to actualizing their plan of care and helping to link them with the support to overcome these barriers. The goal is to help them clarify and actualize the treatment plan, as some of these discharge plans can be quite complex. I just wanted to briefly review the codes that we are talking about when we talk about the TCM code. We have the moderate and the high codes, which are listed here, the 99495 and the 99496. You can see here the associated work RVUs. Remember that the moderate code requires a face-to-face visit within 14 days of discharge. The high code requires a face-to-face visit within 7 days of discharge. Let's review the mandatory components of a TCM bill. We'll delve into each one a little deeper, but let's start by getting an overview first. The patient must be discharged from a qualifying hospital setting. The patient must receive an interactive contact within 2 business days following discharge, or at least 2 separate attempts at contact. Certain non-face-to-face services will be provided by both the TCM team and the provider. A face-to-face visit or hospital follow-up must occur within 7 days of the discharge for a high complexity code, or within 14 days for the moderate complexity code. The patient must meet moderate or high complexity medical decision-making criteria. Only one TCM code can be billed in a 30-day period. Let's take a deeper look at each one of these requirements. Most of the discharges that you will encounter will meet criteria for TCM. As you see from this list, we are talking about acute hospital inpatient stays, acute hospital observation stays, acute rehabs, LTACs, partial hospitalizations, and SNF stays. All of these discharges qualify for TCM. I should note here that emergency room visits only do not meet TCM criteria and will not have intervention by the TCM team. In order to bill a TCM code, you must ensure that there has been an interactive contact within the first 2 business days of discharge. The TCM team will be using a post-discharge phone call template that is already built within Epic. You will receive our communication in your in-basket, just like you now receive it in your inbox in NextGen. The TCM staff will address the patient's status, find out what the patient needs, and furnish any other non-face-to-face services during this call. TCM team will make 2 attempts to reach the patient using the contact information provided in the chart. The TCM service is still billable, however, even if we do not reach the patient. The key is that there are at least 2 separate attempts to reach the patient. Any further attempts to reach the patient can be made by the clinical team within the medical home. I've included this list of non-face-to-face services which are required to meet the TCM billing criteria. These services provided by the TCM team can include things like communication with agencies and services such as visiting nurse providers, education and any form of support that helps with adherence to the discharge plan, identification of resources, and assisting with access to care. Assisting with referrals and linking to social work services might be other examples of this type of non-face-to-face service. Certain non-face-to-face services that are furnished by the provider are also considered requirements of this bill. These are things you are already doing with each and every discharge. This includes the review of the chart, the review of the discharge summary, and any consideration to follow-up testing, the review of pending lab results, etc. Any education that you may be asking your clinical team to discuss with the patient or caregiver is also a non-face-to-face service. Any time that you're asking your clerical team to address appointment needs or even to make referrals, these are all part of this aspect of the TCM billing criteria. As we discussed previously, probably the most important aspect of the bill is the TCM visit itself. Again, this is a visit within 7 calendar days for the high code and within 14 calendar days for the moderate code. The TCM hospital follow-up is the date of service for your TCM bill. In order to bill a TCM, the medical decision-making must meet at least the moderate requirements for the moderate code and, of course, high complexity for the high code. When considering the complexity, you are considering the number of diagnoses managed, the complexity of the records that you are analyzing, and, of course, the risk of complications and morbidity and mortality. Perhaps the trickiest part of the TCM billing criteria is making sure that you are not billing more than 1 TCM in a 30-day period. The billing period begins on the date of discharge and ends 29 days after the day of discharge. The date of service for the TCM is the date that the patient is seen in the office. Any readmission that falls within this 30-day period should not be rebilled for a TCM. We will get into the rehospitalization questions in a bit, but the important thing to be aware of is that only 1 TCM can be billed in a 30-day period. We will be working to find a place to document the beginning and ending of the TCM period within the new Epic system as to keep it clear. Now that we've reviewed the TCM criteria and we've discussed the dates involved, let's review an example to put all the pieces together. In this example, we have a patient discharged on Friday, October 4th. I intentionally used a Friday to show you that the 2 phone calls that need to be made to this patient are on the first 2 business days after discharge. This is the only part of the bill where we refer to business days. All of the other dates are calendar days, but when it comes to the calls, it will be calls made within the first 2 business days. So if a patient is discharged on a Friday, we would expect that the TCM team will contact this patient on either Monday or Tuesday. TCM nurses might call on Monday and leave a message and leave a second call on Tuesday. They might call on a Tuesday morning and make a second separate attempt on Tuesday evening or Tuesday afternoon. So long as the attempts are separate and are within the first 2 business days after discharge, this will meet the criteria for TCM. Now, if we look at the dates for face-to-face visit, to meet the high complexity code, the patient is going to have to be seen on or before October 10th. So it's the first 7 days, including discharge day. So this would be 1, 2, 3, 4, 5, 6, 7. To meet the moderate codes, you're going to have to go 14 days, which would count out to October 17th. So these appointments should be on or before October 10th for the high, or on or before October 17th for the moderate. Kind of a quick fashion, we don't count out the dates, but just to give you a quick way of figuring it out is you can grab the calendar on your bottom right hand corner where you have the date, click on that, a calendar will appear, and what you can do is take a look at your discharge date, count down 2 boxes and over 1 to the left. That's your moderate, that's your most common one. If you do want to go for the high, of course you're going to have to go down 1 box and over to the left. Am I within those 7 days? Yes, go ahead and bill. So that's how we count out the dates. If you're curious about the day 30, we start counting, again, this is day 1, we know this is day 7, we know this is day 14, excuse my writing with the mouse here, and then we've got 15, 16, 17, 18, and we count it all the way out, and we find that the TCM period ends on November 2nd. So we have the start of our TCM period is the day of discharge. Our face-to-face is going to happen somewhere in the middle, and then our TCM period is ending on the November 2nd. So those are quick ways to look at the dates that we're talking about. And just to give you an example of a potential readmission, let's say you've had your face-to-face, maybe it's on the 16th, and you've billed the TCM, that's great. Let's say they get rehospitalized from 10/22 to 10/25. If their TCM is after, let's say they come in on November the 3rd, so we'll say 11/3, you might think, well, gee, they're out of the TCM period. Can I bill that one? The answer is no, you cannot, because this hospitalization here was still within the TCM period. We'll get into that more, but I just wanted to give you that example that if the rehospitalization happens within those 30 days, you cannot bill a second TCM. They're very separate. I want to take a minute to point out the list of insurers that no matter what will not cover the TCM charge. If the patient has one of the following insurance companies, please know that any TCM bill submitted will be automatically denied. So in the case where the patient has these particular insurers, we simply do not submit the TCM charge, and that would include pretty much any Medicaid product. The only exception to that is the AM Better PAP. That is a pretty rare insurance at this point. We do have patients that have it, but that they do cover the TCM, so that's just the one exception. But things like New Hampshire Healthy Families and WellSense will not cover a TCM. Anthem products and Blue Cross Blue Shield products do not cover TCM. That includes Blue Cross Blue Shield Federal and really any other Anthem or Blue Cross Blue Shield product. On that note, there is a a Medicare with Anthem Advantage as a supplement. So it's a Medicare Anthem Advantage plan. As long as it does have the Medicare, it is okay to bill. Medicare will pay your TCM. Let's see, Main Care, TRICARE, Martin's Point, those insurers do not cover the TCM. It is important to note Martin's Point Generation Advantage will cover TCM. We have a few patients that do have that insurance, so just an important distinction to make. And then premium assistance is another one that will not, and the financial aid program at Wentworth Douglas does not cover TCM. And generally speaking, if somebody does not have insurance or is a self-pay, we have not historically charged the TCM codes. Frequently asked questions. Probably the most frequently asked question about TCM is regarding readmission. What if my patient is readmitted? Can I still bill the TCM? The answer is, this comes directly from CMS, by the way, that yes, TCM services can still be reported as long as the service described by the code are furnished by the practitioner during the 30-day period, including the time following the second discharge. Alternatively, the practitioner can bill for the TCM services following the second discharge for a full 30-day period, as long as no other provider bills the service for the first discharge. CPT guidance for TCM services states that only one individual may report TCM services and only once per patient within 30 days of discharge. Another TCM may not be reported by the same individual or group for any subsequent discharges within 30 days. So what does this all mean? Essentially, it boils down to two scenarios. If the patient is admitted after you've already had and billed your TCM visit, the bill will stand. We just will not bill a second TCM for that second admission and second discharge. They will still wind up with only one 30-day TCM period. If, however, the patient is readmitted before they even make their way into your office, we will simply start fresh with that second discharge. We change the day one of the TCM period to the second discharge date. They again will still have this 30-day period with only one TCM charge when they see you for that hospital follow-up. I hope this makes sense, and if you're in any doubt about a patient or their eligibility, please reach out to our team and we can look at the dates for you to determine which visit is eligible. These are a few more frequently asked questions that come right from the CMS website. The first one is the date of service, like which date of service could be used on the claim. And as we've said, the date of the face-to-face visit is the date of service. And remember that day one of your TCM period is the date of discharge. Day 30 of the TCM service is 29 days after that first day. And then the date of service is somewhere in the middle when they come in for the face-to-face hospital follow-up visit. Number two, who can bill the TCM? Physicians and mid-level providers, all the primary care providers within Wentworth Health Partners at this point can bill a TCM. Currently, we do not have specialty providers billing the TCM, and at WIP, we have not really had to deal with competition for the bill yet, but that being said, there are local non-WIP providers and specialties that have started billing TCM, so we will update you if that becomes a trend. According to CMS, the first bill that is submitted is the one that will be accepted. And then the third most frequently asked question is, what if my patient expires before day 30? We would have to make a correction at that point. We cannot bill for a 30-day service if the patient expires before that 30th day, because the spirit of the bill is that this is 30 days of service, essentially. So in that event, we would have to evaluate it and submit a correction. The information that we've covered today comes directly from the following resources. Please check them out if there's something you want to investigate further. There's a great article here from the American Academy of Professional Coders that discusses the changes in 2016 that allow us to bill directly at the time of the visit, if you're curious about that. And remember that CMS encourages this bill because they understand the time and effort involved in managing these recently discharged patients. The spirit of the bill is to capture that non-face-to-face time that you're spending managing these patients. Thank you for taking the time to review this material, and please feel free to reach out to our team. We're available by phone, email, and even Cortext. We're the Transition of Care group in the Cortext platform if you choose to communicate with us that way. You will also be able to communicate with us, as always, via your in-basket in Epic as well. So we look forward to hearing from you. Thanks again.